you're fighting for survival and you don't have the energy to fight with your insurance company.
A few years ago, while working towards a PhD in college, this woman was attacked and raped by another student. She asked not to be identified by name.
I didn't talk about it for a really long time. It was getting to the point that I wasn't really functioning. I suffered severe depression during that period of time, suicidal thoughts, and it was really hard for me to get through every day.
Her work suffered. Faced with losing her scholarship, she sought professional help.
It was very clear that this was a person that would be able to do well, but that would need a lot of help over an extended period of time.
Her health insurance company was Horizon Blue Cross Blue Shield of New Jersey. Like many big insurers, it subcontracted mental health benefits to a company called Magellan. Magellan came into existence to help insurers battle rising costs. It's one of the largest managed care companies that specializes in mental health. Now, Magellan is facing criticism from patients and doctors who say that care is being sacrificed in the name of cost containment. In this case, Magellan authorized a few sessions at a time, which delayed some treatment. Then, after about a year, Magellan just started saying no.
They are denying my claims without explanation. It seems that they don't want me to continue being treated, so they're giving me a really hard time.
My sense is that these patients are being traumatized by the insurance companies. It's sort of trauma over trauma.
Lois Gorwitz is a psychologist who worked for Magellan from 2000 to 2002. She was a senior care manager, which means that she was the one who decided which claims would be paid. Gorwitz says there is a business incentive to deny care.
Managed care companies, it's their job to limit costs, right? If they don't limit costs, the insurance companies are not going to pay them huge amounts of money.
Gorwitz says she was uncomfortable with what her bosses expected her to do, and she quit after 2 years.
You knew that you had to be very, very stingy with what you authorized, and that if you were pretty liberal with what you authorized, that a supervisor was going to be talking to you about it.
Erin Summers, a spokeswoman for Magellan, says that much has changed since Gorwitz worked there. She said, "I think the people who work at Magellan now are not having that experience." She added, "Every plan has to be tailored to the individual situation, not one size fits all." But Jeffrey Axelbank thinks there's a growing pattern of denial.
I get a lot of claims from Magellan, for instance, that come back and say, authorization did not exist for this patient. And I know very well that they did, because I keep scrupulous records about that and keep very careful track of it. And so then it's another phone call.
Axelbank filmed this speakerphone conversation with Magellan.
I'm going to be calling Magellan Behavioral Health to follow up on 2 treatment request forms, TRFs, that I submitted over a month ago.
It took 45 minutes to appeal just one denial. Axelbank says 80 to 90% of his patients with Magellan require this type of intervention, because if it were left up to them, many would just give up.
Mental health patients are not going to be on the steps of the State House protesting. They're going to be hanging up the phone and getting back into bed. And so in a sense, the insurance companies are picking on the most vulnerable people, the people who are at least able to fight back.
I always feel like I have to justify why I feel so awful about the rape.
While some of its patients and doctors have complained of increased denials, last year Magellan earned more than $80 million.
It really makes you call into question your whole identity as a mental health professional. The consumer isn't getting better health care or better mental health care because the managed care companies are existing. Instead, we found a whole bunch of other people to make wealthy.